Okay, welcome to Washington Exec's video series, where we talk to GovCon executives about the current trends and topic impacting industry. I'm Amanda Ziadeh, senior reporter with Washington Exec, and today I'm joined by Bruce Caswell, the president and CEO of MAXIMUS. Thank you so much for joining us today, Bruce.
It's a pleasure. Thanks so much for having me.
Of course. So we've been tracking the impact of the coronavirus pandemic on government contracting, the industry, as well as its employees and people. And today we'll also be discussing the impact on the customer's mission. So Bruce, you lead a company specializing in government services with an international reach and a heavy focus on health and human service programs. And MAXIMUS partners with federal, local, and state government levels. So I wanted to ask you first, how have you seen the needs or critical missions of new or existing customers change during this time?
That's a great question. First of all, I've been thrilled to see how essential, and it's really confirmatory. I mean, I've been at MAXIMUS for over 15 years now, but it's confirmatory to see that the services we provide our government customers clearly are mission critical and essential in nature. Whether that's within the U.S. Health and Human Services space with the work we do administering Medicaid programs, or at the federal level, obviously with 1-800-MEDICARE, the Obamacare federal marketplaces, and so forth. And so there's been a great resilience of the business model just in that regard. And as a consequence, we've been able to, and we'll, I'm sure, get to this in further discussion, we've been really able to keep our operations, our critical operations going, even as we've pivoted the delivery model substantially to more of a work from home kind of hybridized model. That said, the customer needs have very much changed. And it goes without saying, two of the greatest areas where we've seen demand have been for assistance related to COVID-19 itself, whether it's initially standing up information lines to help triage calls and get consumers and get citizens the information they need, to supporting the testing process by taking on a very substantial contract to communicate test results to individuals as they come in from 47 federal testing centers, to more recently doing work in the contact tracing area, where we've announced recently the work we're doing for the state of Indiana, with many other states to follow as they undertake contact tracing as obviously a critical component in the next phase of opening up and reopening their economies. Another component of our work has also been to support our customers, unfortunately, having to deal with the massive unemployment situation we find ourselves in, with today the numbers, I think, saying that nationally more than 36 million Americans are looking for work or unemployed. And so the burden, obviously, on state employment systems has led to opportunities for the private sector to partner to help with benefit inquiry calls and even eligibility assistance for various states. And the good news is the customers are very open to a modified delivery model where, in many instances, the individuals that we're hiring will never have direct contact with. They come to us through hiring supply chain, ultimately, in many instances, bring their own equipment, work from home, are trained from home, and it's like a contactless contact center, if you think about it, right?
Mm-hmm. Yeah, are there any other specific ways in which your team has had to change the way it helps these customers in order to meet and support those needs?
Well, the areas that have most directly been impacted would be those that historically have required face-to-face consultation with customers. And so whether that's employment services that we provide, or support in some instances for child support cases where individuals are seeking to have orders enforced, and there's often a very face-to-face component to that. From a Medicaid perspective, we historically have provided a lot of face-to-face assessments of individuals to determine their level of intellectual disability when they're being released from an acute care setting and into a skilled nursing facility or home and community-based services. Those types of assessments now have to move to telemedicine type assessments. In most cases, often telephonic assessments preceding telemedicine.
Gotcha. And my last question for you is about the impact internally. What are some of the key innovative workplace policies or practices that MAXIMUS is embracing to minimize the impact of the pandemic, protect its people, especially considering the unprecedented length of stay-at-home orders and restrictions? We weren't expecting it to really last this long when it first happened.
Very early on and out of the gate, we wanted to quickly put policies in place that protected our employees beginning with income continuity. So we looked at the Families First Act as a baseline that applied to businesses with fewer than 500 employees. And the challenge to our team was, where can we, first of all, ensure we're compliant with that, but also where should we try to exceed it? So we put in place income supports for our employees that certainly provide for 2 weeks of paid leave if they have any situation related to COVID-19, whether it's a positive test or a presumptive positive test, or if they have difficulty securing childcare because schools are closed or they need to take care of a family member who may be sick. So immediate income supports, because the last thing we want is an employee who's sick coming to work. But we recognize this goes on for a while. So we provided enhanced FMLA, Family Medical Leave Act coverage, enabling individuals, employees to get 2/3 of their salary for up to an additional 10 weeks. And where we exceed the requirements of the act is without having to spend any of their paid time off in order to access that benefit. And we'll continue to look at our policies and make sure that we are doing all we can to support our employees. During this period, we've shifted 45% of our US workforce to work from home. With some constraints being on certain contracts where that's just not possible because the type of information that's being handled on behalf of citizens. And in those cases, we've been able to have more of a shift-based model where you'll have Team A that stays at home and is not working for a couple of weeks, but then comes in and replaces Team B, who then goes home. So we've been able to implement models like that that provide continuity of service to our customers, do not decrease quality, and yet provide protections for our employees.
All right. Well, thank you so much for sharing all of that with us today, Bruce. I really appreciate it.
Absolutely, Amanda. It's been my pleasure. Thank you so much.
All right.
Take care and stay safe.
Thanks. You too.